Turning to one of the most important stories tonight impacting your safety, this surging coronavirus pandemic. Do you remember when President Trump restricted travel to the U.S. by people from countries with lots of coronavirus cases? That was back before the pandemic had spread across America. And whatever one thinks of Trump's instincts on immigration, many countries do restrict travel that evidence shows could spread a new virus. Well, consider how far we've come tonight. News breaking that Europe will bar some American visitors when it reopens because our country has failed to get the spread under control. Now, that's one outside international perspective. Inside the administration, medical experts sounding the alarm, too. Here's Dr. Fauci's stark warning today.
We can't just focus on those areas that are having the surge. It puts the entire country at risk. We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around. And so I am very concerned. We're going in the wrong direction. Clearly, we are not in total control right now.
Going in the wrong direction. Clearly not in control. Dr. Fauci's words, and we'll look at the evidence he's drawing on. U.S. cases spiking 80% in just the last 2 weeks. That's that climb on the right. Most states facing outbreaks are nixing or changing reopening plans. And Donald Trump's own Republican allies are basically speaking out about his well-known shade for wearing masks, noting it actually makes no sense.
That makes no sense. I mean, it actually would help restore the economy if we contain the disease, and the better the economy is, the better off the president is, I would think, running for re-election. So it makes no sense. So I hope the president will help us just get rid of this mask politics. It hurts the country, and it doesn't help him.
It does hurt the country, and as doctors and policy experts, and this show has documented with this chart, take it in, the facts, the charts, the case count do show that the virus can be stemmed. You're looking in April, the very middle of this chart, at where we were, along with Europe, peaking at the same time. Europe, the blue line, applying some of those rules to get their case count down. We, of course, you see up to the right, are still rising. We never did that dip. Now, can policymakers use these facts on your screen to push Americans with the evidence so we learn that sometimes there are other international examples to apply? Well, today, Joe Biden actually stressed that other countries got things under control while he says Trump surrendered.
It didn't have to be this way. Month after month, as other leaders in other countries took the necessary steps to get the virus under control, Donald Trump failed us. And now, Donald Trump is in retreat. It seems like our wartime president has surrendered.
Dr. Megan Ranney, an emergency room physician and a professor of emergency medicine at Brown, and the mayor of Compton in California, Asia Brown. Both of you have expertise on the medical side of this, and what do you do with the medical evidence as a leader, a local policy and government leader? Good day to both of you.
Thank you.
Starting with you, Doctor, you hear Biden referencing it. We understand there's an election coming and people have polarized political reactions, sadly, when there's underlying evidence that knows no party. But that chart that we've shown before, and I showed it again tonight, and it relates to what seems to be a wider emerging consensus even across parties. There are ways to stem this. Other places have done it. The U.S. can do it better. Your thoughts?
Yeah, absolutely, Ari. I've been on this show, and many other physicians and public health professionals have been sounding the alarm for months now. As we've said, this disease is unprecedented, but the techniques to control it have existed for centuries, right? We know that wearing masks helps. Wearing masks alone is not a panacea. We know that physical distancing helps. We know that hand washing helps. These things need to be put in place together and need to be supported with social norms. All of us in society have to decide to do them together if we're going to control this virus. And what we're seeing now across the United States is a failure of leadership to set policies and to set standards and to set norms that the rest of folks feel that they can and should follow. And that's why we're seeing the spread of the virus. There's still time to walk it back, but it is going to take concerted effort at this point. And it is disappointing and frustrating to those of us that have been on the front lines for months now.
Mayor Brown?
Yes, I think it's critical that we have a mandate to direct public dollars into areas of high risk. In the community of Compton, we're 98% Latinx and African American communities, and we still have not had a strong commitment from the public sector to provide testing to my community. I've had to partner with the private sector on having different events for the residents to ensure that they have access to critical health care. We know that we have systemic inequalities that have existed for centuries, and we're trying to overcome the barriers to access of health care, but still protecting the most at-risk, highest need communities, and that's people of color. And so we definitely need a change and a commitment to really reinvest those public dollars into the places that really need it.
Yeah. All of those great points. I want to turn to something else that we prepared, and I think this is really striking to watch. I think viewers will really see something here. And to set it up, Mayor Brown, sometimes people, I'm sure you run into this in politics, there's a kind of a skepticism, and people say, nothing changes, what's the point? I mean, on a host of issues. And on the one hand, I get why people feel like that. We cover a lot of those kind of frustrating stories. On the other hand, from what I could tell, things are changing all the time. And there has been a movement afoot just recently, last few days, by conservatives and Republican allies of President Trump. Maybe people think it's late. Maybe it would have helped earlier. But we're going to report what we see. People suddenly saying, you know what? We got to be better about following CDC guidelines, which includes the mask. If you are within 6 feet, if you're not, keep your distance. If you're within 6 feet, use the mask. And that includes the president. Take a look. This is all new. From many of his most well-known allies.
I just don't see any downside in the president being seen more often wearing it. It's symbolic.
I think that we all should be wearing masks, and I think it would help if the president were to do so as well.
It's serious. We haven't beat it. You've got to wear masks. You've got to social distance.
I'll wear the mask. I want to go to the game. It's a short period of time.
Mayor Brown, how about that?
People need to wear masks. We've heard from the CDC. We've heard from Dr. Fauci. Our country is undoubtedly in crisis. The numbers support that. We need to change the commitment to wearing masks. I'm happy that in my community, people have taken this more seriously than some other places of more, to be honest, affluent Americans. And so we really have to understand that our affluence doesn't give us the privilege to put other people's health at risk. And so I'm hoping that as a nation, we can make a commitment to wear our masks.
Well, what do you think of Sean Hannity getting on board, albeit pretty late?
God bless him. I just hope that more people get on board at this point.
Doctor?
I couldn't agree more. I think the more people that get on board, the better. This is not a partisan issue. Science doesn't respect party lines. And I will emphasize what Mayor Brown said, the importance of making sure that masks are available to everyone. As you know, I run a nonprofit, Get Us PPE, that tries to get donated PPE to healthcare providers in need. We've also provided PPE to protesters, recognizing that folks out there need protection. It is critical for us to make sure that essential workers have masks and have masks that protect them. But we also have to follow all of those other precautions. Masks alone are not sufficient. They are a critical part of the equation, but they need to be accompanied by those other elements of a strong public health response as well. Again, this isn't rocket science, right? This is really basic public health, and it's time for us to invest in it and to get other Americans to believe in it as well.
Yeah, no, Doctor, we're not ready for rocket science. We are just working on regular science here, but trying to get the word out. Dr. Ranney and Mayor Brown, thanks to both of you. Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.